Mhm.
Let's go to diagnosis through the lips. The topic is lip color. The lips are closely related to the health of a human being. Observing the color and physical changes of the lips can help determine the physiological and pathological changes of the viscera, and thereby the possible onset of certain illnesses. TCM holds that the lips have a very close relation with organs such as the spleen, stomach, large intestine, and liver. The lips can thus reflect the state of the essence of the viscera. Modern medical science also believes that the lips, which are rich in blood capillaries, can quickly reveal ailments in the viscera. The lips are a hub of 14 meridians and a center of communication for the viscera. The picture below shows how the corresponding Zangfu organs are distributed on the lips. So number 1 is corresponds to the small intestine and heart. Number 2 is the middle burner. Number 3, the liver and gallbladder. Number 4 is upper burner. Number 5 is kidney and bladder. Number 6 is lung and large intestine. And number 7, lower burner. Number 8, spleen and stomach. Examining the color of the lips is the method by which physiological and pathological changes of the human internal organs can be observed through the colors and gloss of the lips, which allows for early diagnosis of the diseases that are developing in the human body. The normal healthy color of the lips is light pink, but it may change slightly due to differences in a person's constitution and age. When people are sick, the color of their lips varies based on the type of disease they are suffering from. For example, patients with heart disease tend to have dark purple lips. For pale lips are more often found in patients with anemia. If the lips are pale and dry, you should beware of the possibility of diabetes. Bright red lips means damp heat in the Zang and Fu organs. A dark red lower lip indicates deficiency of the spleen. If the lips are dark purple with a tinge of red, it is a sign of stagnation of qi and blood stasis. Yellowish lips. This is often associated with an unrestrained and unsanitized diet and picky eating habits, combined with dampness, heat lodged in the liver and spleen. The symptoms include low spirits and weariness, tired extremities, and dizziness. Black lips. When the lips are grayish black, it suggests a stomach yang deficiency in the middle burner. When the lips are slightly black with a tinge of purplish red, it indicates stasis in the body. When the lips are purplish black, it means there is a blood stasis flowing toward the heart. Bluish lips signify stagnation of qi and blood stasis, signaling that the person is susceptible to acute onset, such as vascular embolism. Thank you so much for your attention.
Let's proceed to interviewing with the third part of types of pain. Let's start with pain with a sensation of stuffiness. This is usually a dull ache accompanied by a feeling of stuffiness. It usually occurs in the epigastrium or chest. Stuffiness may be defined as a mild feeling of fullness with an important objective difference on palpation. Fullness may be felt on palpation as hardness, whereas with stuffiness, the epigastrium feels soft on palpation. A feeling of ache and stuffiness is usually due to a combination of deficiency of the spleen and fullness, which either heat or phlegm. Next, we have pushing pain. This is a sharp pain accompanied by a feeling as if something was pushing outwards. It occurs in the hypochondrium or epigastrium and is due to severe qi stagnation. Next, we have pulling pain. This is a sharp pain accompanied by a sensation as if the skin were being pulled. It occurs only on the head and is due to liver wind. It is of full nature, although liver wind itself may derive from a blood or yin deficiency. Next, we have cutting pain. This is a very sharp pain that feels like cutting by a knife. It usually occurs in the lower abdomen and is due to blood stasis. It is definitely full in nature. Next is throbbing pain. This pain is usually severe and it feels as if there was a throbbing or pulsation. It usually occurs on the head from liver yang rising. It is a full nature, although liver yang may rise from blood or yin deficiency. Next, we have boring pain. This is a severe pain that feels like stabbing with the tip of a knife blade, a nail, or a screw. It is fixed in its location. It is due to blood stasis and is full in nature. It may occur in the lower abdomen, epigastrium, hypochondrium, chest, or head. In gynecology, it is seen in dysmenorrhea from blood stasis. Next is lurking pain. Lurking pain in Chinese, Yan Tong, which means latent, hidden, or lurking pain, is not severe, is not acute, is relatively easy to endure, but is chronic and persistent. It indicates qi and blood deficiency or empty cold in the interior, leading to malnourishment of the channels. Lurking pain usually improves with application of heat. It generally occurs in the abdomen or the lower back. So to summarize the type of pain, if there is soreness, it indicates deficiency of the four limbs or trunk. If there's heaviness, it indicates dampness or phlegm. It is usually in the limbs, head, or the whole body. If the pain is distending, it means chi stagnation, and it's usually at the hypochondrium, epigastrium, and lower abdomen. Pain and fullness, it means retention of food. It can usually be felt in the epigastrium and lower abdomen. Pain and emptiness, it's qi and blood deficiency or kidney deficiency, and it's usually felt on the head. A feeling of cold or yang deficiency is usually felt on the abdomen or limbs. A burning pain is heat or empty heat and is usually felt on the epigastrium or limbs. Colicky pain is of cold or blood stasis. It's usually felt on the epigastrium and lower abdomen. The spastic pain means chi stagnation and is felt in the limbs and abdomen. Distressing pain is due to phlegm or rebellious chi, and it's felt on the chest and epigastrium. Stuffiness indicates deficiency with heat and is felt on the chest and epigastrium. Pushing pain is severe chi stagnation and is felt on hypochondrium and epigastrium. Pulling pain indicates liver wind and is felt on the head. Cutting pain indicates blood stasis and is felt on the lower abdomen. Throbbing pain is liver yang rising and it's felt on the head. Boring pain indicates blood stasis and it's felt on the head, chest, hypochondrium, epigastrium, and lower abdomen. Finally, lurking pain is chi and blood deficiency or empty cold and is felt on the abdomen and the lower back. Thank you for your attention.
Now let's discuss pattern discrimination, the models for pattern discrimination. Throughout history, scholars of TCM have developed a number of categories for pattern discrimination. These categories, although not wholly exclusive, do represent the evolution of Chinese medicine over the course of its history. As cultural, social, and environmental factors changed the ways people in China became sick, certain aspects of TCM theory became more relevant, and practitioners sought better ways of understanding the specific pathological conditions they observed most frequently. We list down the most important of these categories, all of which are used in modern clinical practice to some degree. As with all other aspects of TCM diagnosis, none of these categories paints the whole picture of a patient's health. It is helpful to think of these categories as different lenses through which a patient's condition can be viewed and are frequently used together to describe complex cases. The 8 principles would be the foundation for all other categories. It describes disharmony in terms of opposites, interior, exterior, hot, cold, full, empty, yin, yang. It serves as a supercategory for all other categories. Qi, blood, and body fluids describes disharmony in terms of the vital substances of the body, deficiency, stagnation, and counterflow of qi. deficiency, stasis, heat, or loss of blood, deficiency, excess, or pathological transformation of fluids, edema, phlegm. This is frequently used in combination with the 8 principles and Zhang-Fu pattern discrimination. The Zhang-Fu disharmony is ascribed to one or more of the internal organs, mainly used in internal medicine, one of the most frequently used categories. This is frequently used in combination with the 8 principles and Qi, blood, and body fluid pattern discrimination. The external pathogenic influences. Disharmony is viewed as the result of invasion from one or more of the external influences: wind, cold, dampness, heat, dryness, summer, heat, or fire. The Jingluo or channel system. Disharmony manifests along the course of one or more of the acupuncture channels, applies mostly to regional external conditions and pain, can also be due to internal organ damage, manifesting along the course of its associated channel. The 6 stages. Disharmony due to exterior invasion, one of the oldest classifications of disease in TCM, mainly used in Chinese herbal medicine for diagnosing and treating acute and chronic internal conditions. The 4 levels used primarily for diagnosis and treatment of febrile infectious diseases that begin with invasion of exterior wind or heat. Very useful for identifying the progression and regression of many diseases. And the Sanjiao, also used for febrile diseases, usually in combination with the 4 levels. And this is commonly used in herbal practice. Thank you for your attention.
Let us go to differential diagnosis. The topic is constipation, looking at it in a Western and CM difference. So for Western differentiation, let's look at number 1, the common causes, which is low fiber diet, poor bowel habits, lack of exercise, sedentary lifestyle, not drinking enough, stress, travel, and medications. Number 2 is mental emotional. One could be irritable bowel syndrome, which is constipation alternating with diarrhea, abdominal pain, distension, flatulence, and emotional distress. And then the next one is depression. This is constipation with fatigue, sleeping problems, change in appetite, sadness and depression, poor concentration, inactivity, and withdrawal. And it could also be due to anorexia nervosa, which is constipation with dramatic weight loss, muscle atrophy, loss of fatty tissue, amenorrhea, low blood pressure, tooth decay, yellowing of skin, and depression. And there's also anxiety or embarrassment. And the number 3 is endocrine. When there is hypothyroidism, the constipation will be with weakness, fatigue, cold intolerance, weight gain, depression, joint or muscle pain, brittle hair, and fingernails. Number 4 is tumors and growth. So there's colorectal cancer, where there will be blood in the stools, anemia, abdominal pain, intestinal obstruction, and weight loss. There's also tumors of structures outside the colon, where there's pressure exerted on the colon. And then there's number 5, which is the megacolon. One is the Hirschsprung's disease, which is a congenital disease where there's delay passing the first stool after birth, vomiting, and poor weight gain. And for the next one is the acquired megacolon, which is a complication of ulcerative colitis. Number 6 is anal lesions. Number 1 is fissure, where there's blood on surface of stool, pain on bowel movement, and cracked anal skin. And next is thrombosed hemorrhoid, where there is anal itching, anal pain, and bright blood in the stools. The next one is diverticulitis, where there's pain in the left lower abdomen and rectal bleeding. For the Chinese differentiation, number 1 is organ interrelationships, where lung and the large intestine is internal and external pairing. Stomach and large intestine is a Yang-Ming and Sheng cycle. Metal and water, which is the Sheng cycle. Heart and large intestine and liver is the Ke cycle. Number 2, the nature of constipation. Where dry stool is heat or yin or blood deficiency. If it's pebble-like stools, there's heat, liver, qi stagnation. If it's very dark or brown or black stools, that is heat. Neither dry nor hard is qi or yang deficiency or qi stagnation. Moist with mucus is phlegm. Long thin stools is spleen qi deficiency. Abdominal pain and distension is stagnation of liver qi. Severe spastic pain is cold and toxic heat. Exhaustion after bowel movement is qi or yang deficiency. Number 3 is the most involved organs, like stomach, where it's the origin of the fluids. And then the large intestine is the eliminator of waste. The spleen is the transportation of stools. Liver is smooth flow of qi. Kidneys controls 2 lower orifices. And number 4 is etiology for constipation is poor diet, which if you eat a lot of spicy food, cold food, lack of fiber, or there's food poisoning. Emotional stress like anger, resentment, and frustration and worry can also cause constipation. Lack of exercise, overwork and childbirth, febrile disease, which is an external pathogen progressing to the interior. For the Zangfu organs, that we will look at the excess and the deficiency. For excess, it's heat in large intestine or stomach, stomach fire, food stagnation in stomach, stagnation of liver qi, liver fire blazing, fire toxin in yang ming. And for the deficiency, it's spleen qi deficiency, stomach yin deficiency with empty heat, kidney yin deficiency, and kidney yang deficiency. Thank you so much for your attention.
Let's now proceed to fu viscera and irregular organs with large intestine. The large intestine is also located in the abdominal cavity. Its beginning portion, the cecum, is connected to the small intestine, and its lower end terminates at the anus, also known as the yin orifice. The large intestine's important physiological function is to receive the chyme sent down from the small intestine, further absorb some fluid from it, transform the remainder into feces, and finally to discharge the feces from the body through the anus. Here is an illustration showing the small and large intestine, which are located beneath the liver and the gallbladder and the stomach. The large intestine's function primarily is to the transportation of waste. Small intestine, on the other hand, function is to receive unprocessed food and drink, and it separates the clear and the turbid through its contracting and dilating mechanism. So it absorbs the essential nutrients and transports waste into the large intestine. This function of the transportation function of the large intestine may lead to accumulation of dampness and heat in the large intestine and may cause constipation. Thus, the plain question states the large intestine is the transporting official in charge of transforming and passing the matter. This process depends on the normal functioning of the large intestine and also requires participation by the stomach, descending transportation, the lung, in dispersion and depuration, and the kidney in qi transformation. Failure of large intestinal function can lead to berberismus, diarrhea, and abdominal pain. If the large intestine absorbs too much fluid, the water matter becomes dry and hard, resulting in constipation and a dry and red tongue. Accumulation of dampness and heat in the large intestine can cause stagnation of qi and blood, resulting in diarrhea and dysentery. The large intestine, a tract organ, is located in the abdomen. Its upper end is connected with the small intestine at the ileocolic opening and its lower end with the anus. Its meridian is connected with the lung meridian, and they have an interior-exterior relationship. It can absorb the remnant water from the residues and then discharge them out of the body. Its main physiological function covers 2 aspects. Number 1, it is in charge of transporting and transforming residues. In other words, it receives the food residues from the small intestine, absorbs the remnant water, and transforms the residues into feces, while finally discharged out of the body via the anus. If this function fails to work properly, there will be such symptoms as loose stool, diarrhea, and constipation, etc. Second function, it can absorb the remnant water from the residues transported from the small intestine, thus influencing the discharging of water in some degree. If the residues stay in the large intestine for a relatively shorter time, there will be diarrhea due to less water absorption. On the contrary, if they stay for a longer time, there will be constipation due to excessive water absorption. The transportation and transformation of the large intestines are actually attributable to the descent of the turbid by the stomach. So, if the stomach fails to descend, the large intestine will be involved. Owing to the fact that all the viscera are interrelated, disorders of other viscera may also affect the large intestine. For instance, if the lung fails to descend and purify, or if the kidney fails to transform qi, there will be constipation. If the kidney fails to warm the body, there will be diarrhea. Moreover, the malfunction of the small intestine to separate the lucid from the turbid may also involve the large intestine. Thank you for your attention.
We go to diagnosis according to Zhang-Fu organ patterns. This time we talk about small intestine qi bound. This pattern is an acute pattern. Acute appendicitis will fall within this category. The difference between this pattern and the previously mentioned is that in this pattern, there is not only a stagnation in the movement of qi, but also an actual blockage. When there is a stagnation of qi, the movement of qi is impeded, disrupted, or irregular. When there is a blockage, there is no movement at all. An invasion of exogenous cold will block the movement of qi down through the small intestine. The cold can have entered through the mouth, such as when food or beverages that are cold in their temperature or energy are ingested. The cold can also have invaded through the skin of the abdomen or through the in channels in the legs. This will happen if the person has been exposed to climatic cold or worn inadequate or wet clothing. Symptoms and signs include abdominal bloating, acute and intense abdominal pain aggravated by pressure, constipation, vomiting, borborygmi, flatulence, painful facial expression, inhibited or limited body movements. The pain is ameliorated by warmth, aversion to cold, cold abdominal skin, thick, white, and greasy tongue coating, wiry pulse in the chair positions. Key symptoms are intense abdominal pains, constipation, thick, white, and greasy tongue coating. Treatment principle, expel cold and disperse qi in the small intestine. We can choose from REN 6, Sanjiao 6, GB34, liver 3, liver 13, stomach 25, spleen 4, spleen 6, stomach 39, and Lan Wei Shui, which is an extra point. Needle technique is draining. Moxa is recommended. REN 6, Sanjiao 6, stomach 25, and stomach 39 invigorate and regulate qi in the small intestine. GB34, liver 3, and liver 13 spread liver qi. Spleen 4 and spleen 6 tonify spleen qi and regulate qi in the small intestine. Lan Wei Shui is an empirical point for acute pain and blocking of the intestines. This is an acute pattern, therefore diet and lifestyle advice will have a limited effect. The person will benefit from eating or drinking things that are warm and spicy in their dynamics, such as ginger or turmeric. Small intestine qi bound can be caused by liver qi stagnation, invasion of cold in the stomach, and small intestine deficiency cold. It can result in liver qi stagnation and spleen yang deficiency. To summarize, small intestine qi tide etiology is excessive consumption of cold and raw foods, hindering transformation function of the small intestine. The underlying accompanying pathology includes stagnation of liver qi invading the spleen, spleen qi deficiency. Signs and symptoms: intense abdominal pain, intolerance of pressure on the abdomen, abdominal distension, constipation, vomiting, borborygmi, flatulence. Pulse will have thick. The tongue will have thick white coating and the pulse will be deep and wiry. Treatment principle: course the obstruction in the small intestine and rectify qi. Harmonize the stomach. Acupuncture treatment: stomach 39 is used to move the small intestine qi and stop pain. REN 6 to move the qi in the lower burner. Spleen 6 to stop abdominal pain. Stomach 25 to stop abdominal pain and harmonize the stomach. The extra point Lanwei Shui if appendicitis is suspected. GB34 to move stagnation and relieve pain, and liver 3 to stop pain and spasms. Needle with drainage. Thank you for your attention.
Let us go to etiology and Chinese medicine. The topic is diet, maladjustment of work and rest, part 2. Maladjustment of work and rest includes overexertion and overrest. Generally speaking, normal physical activities and training are helpful for the circulation of qi and blood and for strengthening physique. Necessary rest will eliminate fatigue, restore physical and mental strength. Let's talk about overexertion. This includes excessive physical labor, menstrual strain, and sexual indulgence. So for excessive physical labor, this means an excessive labor lasting over a long period of time. The main effect of physical overexertion is to damage the body's primordial qi, which can lead to reduction in stamina with disinclination to speak, mental fatigue and lassitude, and emaciation. In addition, some structures involved in the labor may suffer damage. As the plain question states, prolonged standing damages the bones, and prolonged walking damages the sinews. Next is excessive menstrual strain. This wears out heart blood and damages spleen qi. Thus, the heart spirit loses its nourishment. It can lead to palpitation of the heart, forgetfulness, and insomnia with excessive dreaming. In addition, spleen dysfunction can lead to food retention, abdominal distension, and loose feces. Next is excessive sexual indulgence. This leads to exhaustion of kidney essence. Clinically, there often are lumbar and knee aches and weakness, blurred vision and tinnitus, dispiritedness, and reproductive dysfunction. In males, there may be nocturnal emission, premature ejaculation, or even impotence. In females, there may be menstrual irregularities or infertility. Number 2 is excessive rest. This denotes excessive rest and comfort with little physical labor or exercise activity for a long time. The human body requires an appropriate amount of physical activity every day in order for qi and blood to circulate smoothly. Absence of physical activity for a long time can easily impede qi and blood circulation and impair spleen and stomach functions, and lead to loss of appetite, loss of strength, listlessness, weak limbs, and trunk or obesity. There may be palpitation of the heart and labored breathing, even on slight exertion, and profuse sweating. Other illnesses may ensue. This is what is meant by the plain questions. Prolonged lying in bed damages qi, and prolonged sitting damages muscles. So here we can see the other internal causes of illnesses. So there's normal labor, but then some people have overease, and then some have overstrain and overthinking, and there's also supernutrition, where there could be hyperlipidemia, hypertension, diabetes, coronary heart disease, and cholecystitis and gallstones. So when a person has a high carb diet or high fat diet, or if it's high in protein or too much alcohol, or there's preference for strong flavors and drinks, eat too much raw or cold food and drinks and pungent or hot food, or they go for a vegetarian diet for a long period of time, it can cause malnutrition, and that is qi insufficiency of spleen and stomach. Or it could also be when people eat things like sprouting potato or toxic mushroom, stramonium, puffer fish, and water hemlock, or if they're exposed to bacteria and viruses and pathogens and parasites from unclean food and drinks, it can cause belching, acid regurgitation, vomiting, diarrhea, abdominal pain, and dysentery. Thank you so much for your attention.
Let's now talk about one of the emotions, love. Here, love does not mean the normal affection felt by the human beings towards one another, such as, for example, the love of parents for their children and vice versa, or the affection of a loving couple, but rather obsessive love for a particular person. Love also becomes a cause of disease when it is misdirected, as happens, for example, when a person loves someone who persistently hurts them, whether physically or mentally. Obsessive jealousy would also fall under this broad category. Here is a clinical picture of love. In pathology, can cause insomnia, mental restlessness, a red tip of tongue and a red face, with an overflowing pulse on the heart position and palpitations. Love, in the sense outlined earlier, affects the heart and it quickens chi. This will be felt on the left front position or the heart position with an overflowing quality, and the pulse will also be rapid. It may cause heart fire with such symptoms and signs as palpitations, a red tip of the tongue, a red face, insomnia, and mental restlessness. Here is a flow chart of the effects of love, which quickens chi and leads to heart fire. To summarize, love here does not mean the normal affection felt by human beings towards one another, but rather obsessive love for a particular person. Love also becomes a cause of disease when it's misdirected, as happens, for example, when a person loves someone who persistently hurts them, whether physically or mentally. Obsessive jealousy would also fall under this broad category. Love affects the heart and it quickens chi. Thank you for your attention.